Hello, today we are talking about oral hygiene. We recently talked about dental decay. Of course, oral hygiene kind of curtails right into that. The main objectives of oral hygiene when it comes to dentistry, let's say, of course, is lowering plaque and tartar, removing it as best we can, which then lowers gingivitis and gum disease and, of course, potential for cavities. I will say, being a practicing dentist, it's always incredible to me to realize that there is such a variance of risk profile. This is something that one of my best mentors, Dr. John Coys, taught me, and it was so eye-opening, and it's so true. Not everybody is built the same. Not everybody has to brush the same. Certainly people have different risk profiles. High risk, moderate risk. It's very patient specific. I have patients that I don't even think they know which end of the toothbrush to put in their mouth, and they never have cavities, never have tartar, never have plaque. They come in probably because their husband or wife makes them come in, and they've never had a cavity, and they just simply don't have much dental need. I will tell you a funny story that hopefully my hygienist or her husband doesn't get mad at me, but one of my hygienists, I have never seen her husband. He never gets his teeth cleaned, and his wife is a dental hygienist. That's what she does all day long. And she could clean his teeth for free. It's not a financial issue. And I think she just said that he just doesn't get cavities, he doesn't have problems, and so he got lucky. He picked good parents. And I've seen this. And vice versa, I've seen patients that, boy, they can't brush or floss enough. They have gum disease, or they have cavities, or both. One or the other usually, and these people are trying really hard, and they're coming in every 3 months, and they're using the fluoride and everything we can throw at them, and we just can't seem to keep up. So we do our best, but so let's get into some of the ways that we try to improve oral hygiene. We mentioned a lot of these in the dental decay podcast. We try to break up the bacteria. That's going to be your brushing and flossing mainly. When it comes to brushing, the question about electric versus manual. Some of the advantages the electric toothbrush have, what I tell my patients, is there's nothing different really with the bristle itself. They have timers, some of them move for you, and they tell you how long you should be brushing for. They kind of automate the system. The Sonicare is the most common one that has these sonic vibrations that claims to break up the plaque and tartar. I can't say that I know that to be true, although I will tell you my patients that use Sonicares love them, and they just tell me, oh man, my mouth feels so clean. Usually when people get a good electric toothbrush like a Sonicare or an Oral-B, they almost never turn back. They're usually sold because they love the way it makes their mouth feel. I've used both Oral-B and Sonicare. I can't say I notice a huge difference. They're both great, and definitely when I use those, I tend to brush longer. I don't have to worry about getting every nook and cranny because the brush itself does some of the movement for me. So it takes some of the legwork out, and that's where basically electric toothbrushes are superior to manual toothbrushes because of the bells and whistles. But I have people that use manual toothbrushes very effectively, and that's more than enough for most. We can try to kill these bacteria. We have essential oils. That's in Listerine. You see that. That's shown to lower gingivitis by killing some of the bacteria from the essential oils. That's what burns. We also have triclosan, Triclosan. That's been in the news lately. It's early in 2014. That's been in the news recently because it's the active ingredient in Colgate Total. And Colgate Total has triclosan. Triclosan does in fact help with gingivitis. So patients that are at risk for gum disease, I do encourage them to use Colgate Total. I kind of go back and forth because you'll get these studies that say triclosan causes all these problems. And so for a while I was avoiding it, but for that specific niche of patient, I still think the benefits may outweigh the cons. But ultimately, we have triclosan. We have stannous fluoride. We'll also have chlorhexidine that can kill bacteria very, very well. Problem with chlorhexidine, it can stain your teeth, so you can't be on it for very long. Another interesting aspect of improving oral hygiene is trying to prevent the bacteria from attaching to the tooth. It basically makes the tooth very slippery, if you will. And this is kind of new. I don't use these products, although the research is very interesting. We have one called Perio Shield. The other one that I read about that seems very interesting is called Livionics. Let me spell it. Livionex. You can Google it. It's an activated I'm not even going to try to pronounce it. EDATHAMIL. And it seems to make the tooth slippery, and it makes it so the bacteria don't attach to the tooth. That's my understanding of the mechanism. Pretty interesting stuff. Then we also have selective beneficial bacteria. That's going to be the Probiora or the Probiotics. Evora Plus is another one made by Oragenics. This is going to be trying to populate your mouth with good bacteria to overpopulate so that the bad bacteria get sort of run out of the field, if you will. Then we have other ways of trying to alter the immune response. This is basically we have a low dose antibiotic called doxycycline that is given to help reduce the inflammation. Just to be clear, it's such a low dose it does not work as an antibiotic. It is an antibiotic, but it's at a low dose where it just helps reducing the inflammation. So these are some of the ways we have in dentistry today to help people with their oral hygiene, reducing plaque, gingivitis, gum disease, etc. Thank you.